Hi, good morning, everybody.
Hi, good morning.
Can't believe it's already December.
Well, it is December because we're both wearing our winter
Whites,
whites.
matchy matchy. So hard to believe December is already here. It's like the days roll into weeks, the weeks into months. And, we just wanted to give a big shout out and a great big thank you to all of our patients who have trusted us in their care for all of these years. And this last year, it's been a great year. It's been a challenging year for a lot of people. And as always, we're just really appreciative of the trust that you put in our care. It's a responsibility that we take seriously with a lot of love. Well, let's talk about trends. So what are the two new trends, do you think, for 2026? We've already seen kind of the birth of custom medicine. So things like people getting their DNA checked, getting customized hormonal treatments. And of course, that also goes into the space of dermatology and skincare. So this emphasis on how can we really tweak all of our procedures, it's not a one size fits all, but really how can we customize our treatments to best suit your needs? So combining therapies together, different lasers, different machines, different skincare, including prescription things, over-the-counter products. So I think it's really going to move more and more into this field of customization.
And I like to think that the exosomes, the PRP, the secretomes, they're kind of like icing on the cake. So it's not just we're going to do secretomes or exosomes, it's in addition to, they're boosting everything in terms of that regenerative turnover, matrix, collagen, structured, elasticity realm. So it's really exciting.
Yeah. Well, I think it's kind of getting back to that whole thing, right? Custom medicine, and really what we want is to help regenerate the body, right? And help us feel as healthy as possible and keep our tissues robust and so that they really survive the test of time, right? We're really lucky, I think, that we're here in Canada and we're living at a time that people are living longer and longer, right? And we want to make the most of our lives, and part of that is taking care of your health. It's exciting. It's really exciting.
Well, speaking of body, a lot of these treatments are moving off the face. We're really focusing on skin on the body. Neck, always big concern. We've got lots of neck treatments, but décolleté, skin on the front of the abdomen. I mean, you name it, these treatments are going everywhere, really.
Oh, for sure. And I find like as our laser devices become more and more sophisticated over time, so is our ability to actually treat off body, right? In areas that sometimes in the past used to be a little bit tricky. But now, for instance, we can do, patients that have sun damage all over their arms and all over their legs, they can come in and with an hour or two have treatments that really kind of turn back the clock, 20 years of sun damage, which is pretty cool. The other trend, big trend we're going to see in 2026, speaking of the body, so we're seeing a huge rise of like the GLP-1 antagonists, so drugs like Ozempic and Mounjaro, which I think is great. I think these drugs show a lot of promise and people are losing a lot of weight. So people that just needed that little extra nudge or that little extra help are able to kind of get their body into tip-top shape in a really healthy way. The one thing that we're seeing is sometimes as people lose a lot of the weight, we can see that effect on the face, and it's making some people look a little bit aged, perhaps a little bit tired. So that's going to be one of our, challenges, or one of the things or trends, let's say, for 2026 is really as people are moving towards their healthiest body, making sure that we keep their face looking as healthy as possible, right? But in a natural way.
Yeah, it's the connectivity between the epidermis to the dermis to the subcutaneous fat, that hypodermis, and then that subcutaneous fat has to be robust as well. I mean, we all have it. It's what makes us look youthful and have
to take care of ourselves. We want to feel our best. And sometimes there's an obstacle of fear. People not knowing what the downtime is going to be like. Am I going to bruise? Is there going to be pain? So these are really, these are obstacles. And so I think that's the one thing we're going to develop even further is let's do like a deep dive into these obstacles and make things as comfortable as possible. Our one big program that we're looking at for 2026 is how can we do lasers comfort plus. We're going to be creating a whole set of protocols that we can have an in-depth conversation with our patients in advance to really find out what is actually the best way of making the procedure as comfortable as possible. And again, that's very customized. So everybody's a little bit different. And really, we're going to do that extra step to optimize and make this thing as comfortable as possible. So at least we can take away that one element of fear and that one obstacle.
A lot of our patients have already experienced this because they have shared with us their low level of pain threshold, but they really were motivated to get their treatments done. And there's 3, 4, 5 different elements that we can put together and offer in, say, 30 minutes before the treatment, 20 minutes before the treatment, 5 minutes before the treatment. It's done with either Dr. Poulos and myself side by side with the patient and our technicians. And it really comes together in the end. And then they felt very comfortable and they're thrilled they went ahead and did it.
Exactly. And we're going to be looking at adding some new things actually in 2026, new pain alleviators. And then let's talk about downtime, right? So downtime is always like a concern, right? Most of our patients have super busy lives that they planned and love to travel, lots of parties. Planning around downtime is hopefully something also that we can kind of dive even further to and just help people get it done. Right? So we know what we want, but we also have to just actually make it happen.
So we've got wonderful, wonderful procedures to choose from. It gets crazy confusing on which one is the best. They're all good. We wouldn't have them offering in our clinic if they weren't great results, safe. We've all done the treatments ourselves, so we can finagle the downtime, as Dr. Poulos was saying, to get 2 or 3 or 4 treatments done in a year, working around social holiday schedules, vacation
responsibilities,
schedules.
there's always work. Yeah.
Hiding it so your work colleagues don't know what you're doing. It's your own little secret.
Yeah. So that's really like part of the customization, right? That we talked about is that we can really customize. So if we know what the downtime, what you can handle, what you can't, then we can almost work in reverse to figure out where the best plan going forward is.
Dr. Poulos and I were just asked to speak on behalf of Cyton, and they're launching a new handpiece, as we mentioned in another video. One of the reasons why we love Cyton is the precision of the treatments that are delivered for our patients. And if the word fractionated is not a word that you're familiar with, basically what it means, and you can watch our other videos on Cyton videos as well, the treatments are delivered in small pulses, and then there's skip areas between the pulses where the skin is left intact. And we can change the density, so you can have a 6% treatment, and it's really quick to recover from. You can have a 20% treatment, which might take 5 to 6 days to recover from. And believe it or not, if we crank it up to even just 30%, that's a lot of coverage. And that might be more like 7 days recovery. So that is an example of that downtime talk track that is really necessary to get the ball going.
So what would you say was like the big trend in 2025?
Well, 2025, we had a lot of searches on the internet. We had a lot of ask in the clinics for patients who are seeking a more natural result with natural products and elements. The word autologous might be on some people's vernacular now, which is basically meaning something like PRP or PRF, or even the secretomes from Acorn Labs that we offer, where it's coming from you and then back into you. Yes, to help. Yeah.
I would agree. I think there was like a huge uptake, right, in the number of procedures that we did this year with PRP, and we had fantastic results with our PRF. All natural, so people don't have to worry about reactions. So yeah, I think that was a huge trend.
And then the one area that was trending for PRF for our clinic was tear trough area. So we did a number of treatments of tear trough for people.
Yeah, many.
And results are just, they're are really amazing.
And I would say in going into 2026, I think we're going to even see more of that. So this emphasis on rejuvenating the area around the eye, so periorbital rejuvenation, because it is one of the areas that's very, very tricky to treat and has to be done very carefully. Otherwise, there can be complications and sometimes an unnatural look. So I think we're going to see even greater interest in rejuvenation around the eye. So we're combining our, autologous treatments with our exosomes, the secretomes, the PRP, the PRF, and then combining different energy-based devices. And then again, at all different levels. So from the gentlest of gentle to the strongest of the strong, and that really depending on how it fits into our patient's goals and expectations.
Yeah. Speaking of natural, you and I both have always delivered our filler treatments in a very natural way. So with the 2024 going into 2025 kind of filler fear and filler phase and filler fatigue phenomenon that was happening, where people were calling saying, I have to get it all dissolved. It's like, no, you don't. You don't have to get it all dissolved. Come in, let's review.
Yeah.
Oh my gosh, you look great. This looks natural. It was done at our clinic. Of course it looks natural. So
trends
for 2026 is natural results, including the fillers.
I agree.
Yeah.
Well, we saw sort of as we went from to your point, from 2024 to 2025, there was a lot of filler fear, right? So like you said, people wanting their filler dissolved. Why are these movie stars looking so strange? I have a friend, ... right? So there's a lot of filler fear. And I think what's going to happen is, again, the trend as we go from 2025 to 2026 is people are going to increasingly understand that it's not about the filler, right? Filler is just a tool. It's actually the hands that are treating, right? That's going to make all the difference. And, these treatments have been done for 15 years with amazing results. And I think that will be a big trend, is people kind of understanding to a different level that it's really not about the product itself. It's about how it's being done that merely makes the difference.
It's a tool. It is a process and a procedure that is not ever going to go away.
Exactly.
Yeah.
I have to say, my favorite analogy to this, I tell my patients all the time, it's like you're renovating your house, okay? Everybody wants their house renovated for sure. And we know that process really depends on who's the architect and who's the builder and who's your designer. And if you have a good team putting it together, you're going to get amazing results at the end, exactly what you wanted. But if you get the wrong team, it can be a disaster. And the same thing happens when you're trying to get your face to be healthy and your skin to be healthy, right? You just need the right team. It's not about the hammer or the nails or the glue. Really, it's all about your team. So before we finish off, we just wanted to say a big thank you to people that are watching us on YouTube.
Yes.
We just hit 250,000 views, which is amazing.
Yes, thank you to all the people who are listening to genuine, good, helpful, we're trying to be so educational, encouraging. And
we just hope it's very helpful for you, that you've learned a few things and that you know that we're always honest and ethical and we have integrity in everything we do. And we just hope that it's helpful for you. So a big thank you to everybody.
It's like you're in the clinic with us.
We always love your feedback. So if there's anything that you would like us to talk about in 2026, please let us know. Drop it in the comments. We love to see the comments and we really want to be responsive to you.
Thank you. Big thank you.
Happy holidays to everybody. Wishing everybody a really safe and happy time.
Have an amazing family time, friend time, downtime, reset time, because this is a great time of year to get it all done.
Bye for now.